This segment on Bridge Steet is sponsored by Aging Advocates CNY.
Being a caregiver for a loved one is rewarding, but it can also have an impact on the caregiver's mental health.
There are ways to preserve your own mental health to prevent burnout. Here to tell us how, we have Melissa Murphy, founder of Aging Advocates CNY, and Dr. Melissa Carmen, a licensed mental health counselor. Welcome to you both. And, this is a topic that, oftentimes we maybe forget about, right? That the caregiver has to worry about their own mental health as well. So why is it so important for the two of you to work together, I guess, on this?
Yeah, so we do have a shortage of mental health providers in the area, so it's really important that we do know who has availability and accessibility. So I was so happy when I started working with Dr. Melissa here, once I realized she did have a specialty in caregiver mental health, but also made it very accessible for clients to get with her.
So what are some recommendations for caregivers that they should consider when to preserve their own mental health and prevent this burnout?
One of the most important things is that certainly when taking care of a loved one, you are thinking about what they may need and what services they may need. But it's such an important question to ask yourself, what is it that I need? And it's a question that's often neglected, especially by caregivers. But it could be as simple as, I need to get out for a walk once a day. I need to see a mental health provider. I need to work with an aging life professional. So it's recognizing that you're not intended to do this alone by any means. And so asking yourself, what is it that I need to truly take care of your own mental health?
Dr. Melissa, can you give us an idea of maybe some warning signs that may come into play for somebody that, you know what, I'm creeping closer to being burned out with this and I do need to take a step back or, practice some self-care here?
Absolutely. When anybody goes through something stressful, we have an automatic response system in our bodies. It's physiological, you can't help it. And it's a fight, flight, or freeze response that serves to protect us for survival. But the reality is, in most of these situations, we're not fighting for survival, but our body doesn't know the difference. So when you recognize that you're trying to run away or you're avoiding dealing with the situations, or maybe you're in denial, you're trying to put earmuffs on so that you don't really know the gravity of the situation, that might lead to things like sleeplessness or major changes in appetite or depression, anxiety. Lots of different things may indicate that those are red flags for your mental health, and it's certainly time to seek out more support.
Melissa, in the work that you do, were you hearing from caregivers, that they might be experiencing some challenges?
Absolutely. Caregiver or care partner burnout is something we see all the time. But another area that we don't talk about enough that comes up quite a bit in our aging life care field is when the older adult has untreated mental health concerns, and now they are needing certain care needs as they get older. And so now this adult child who has maybe grown up with a parent that was not the most stable, and now they're really struggling with, how do I give my parent the support they need without burning myself out and going down this mental health spiral? So that's where we really do try to partner with the mental health provider, but then the aging life care professional is able to be that buffer between the adult child and the older individual, making sure that both of their needs are met in a very unique way that I think only an aging life care professional can do. So that is something that families do reach out to us for.
Dr. Melissa, sometimes it can be difficult to say, you know what, I really need to talk to somebody. So how do you, what would you advise somebody who could probably use your services but is hesitant to reach out and take that step?
I think that the nature of mental health services are really changing from it being a more mental illness standpoint to being something that is more preventative. And so as we have more of these conversations about what mental health professionals can offer in a preventative sense, it's wellness oriented. It's how do we help our relationships? It's how do we take care of ourselves? It's how do we process stress in a way that is much more proactive than it is waiting for the bottom to drop out. But sometimes the bottom does drop out, and that's when knowing your resources in your community is so vitally important.
So talk about the Aging Life Care professional. There's a site that they can go to learn more, to get matched up?
Yeah, so you can go to aginglifecare.org and put in your zip code and see all of the aging life care providers in your area, whether it's Central New York or all the way out in California. And so if you are in Central New York and want to know who should I reach out to in Buffalo or somewhere else, you can always reach out to us first, because we do have a great relationship with the other network providers, so we are happy to pair you up with someone in your area.
All right. Well, thank you both for the work that you're doing. It is very important work, and for more information, you can visit Aging Advocates at agingadvocatescny.com, and for information on CNY mental health counseling, visit cnymhc.com. This segment has been sponsored by Aging Advocates CNY.